The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
NEC Remit. Send money online to India. Credit in seconds with great rates. Download NEC Remit app now.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain. With over a decade of existence in Bahrain, exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 3885 2397 or visit www.bahrainmediacity.com. Since 2006, Magnum Imprint have been offering high standards of quality with our professional team that delivers all your advertising and promotional requirements efficiently and promptly. For more details, please contact 39887088 or 33856330 or 33542530.
Hello, good evening viewers. Welcome to today's episode of KIMSHealth Doctor Live. Myself, Kripa Rajiv. Health is wealth and we are taking tiny steps to build a better health. In this episode, we have taken the topic general surgery for discussion. To talk more about this topic, we are having an efficient doctor with us. He is having 11 years experience in surgical field. It's my pleasure to welcome Dr. Hafiz Ansari to the show. Hi sir, welcome to the show. How are you doing?
I'm good, thank you. How are you?
Can you please tell about yourself, sir?
I'm Dr. Hafiz Ansari. I am consultant surgeon at KIMSHealth Hospital, Assam. I've been working here for the past 1 year and I have 11 years experience post my post-graduation.
Sir, can you please explain or introduce what is general surgery to our viewers?
Of course. General surgery means head to toe, we do everything. In fact, any surgical procedure is required for your disease condition. All the parts we manage, except for brain, heart, and the kidneys. Usually, they will be dealt with super specialist, either a neurosurgeon, a cardiothoracic surgeon, or a urologist. Otherwise, all the general surgical conditions are dealt with by general surgeons.
What are your special interests, doctor?
I have special interest in keyhole surgery or laparoscopy, as well as minimally invasive procedure for varicose veins. That means either laser ablation or a Venice seal, which is a glue treatment for which is a novel treatment for varicose veins, as well as minimally invasive surgery for proctology. Proctology means diseases of the anal canal, which is your hemorrhoids or piles, fissure, fistula in ano, etc.
Are these procedures are done at KIMSHealth Hospital in Malaysia?
Of course, all these procedures are done at KIMSHealth Hospital, Umalasam. We have a fully equipped operation theatre complex, which includes 3 theatres as well as an endoscopy unit. And we have adequate support in the form of a full-time anesthetist as well as a cardiologist and our physicians to help us with these all the surgical problems and the associated medical problems that any patient will have.
Can you please tell us what are the facilities available at KIMSHealth Hospital in Malaysia?
We have a 24/7 emergency department and a fully equipped general surgery department and all surgical specialties including general surgery, obstetrics and gynecology, urology, orthopedics, etc. We have an ICU as well for both the medical and surgical specialties, and we have a cardiologist, a full-time cardiologist who will be available 24/7. Also, there are the labs, X-rays and of course ultrasound and CT scan facilities are also available in our hospital.
When I asked you about your special interest, you were mentioning about varicose vein. Can you please tell us what is varicose vein?
Actually, the name varicose veins means dilated tortuous veins. That is actually only a part of the problem. The term that we usually use is venous insufficiency, chronic venous insufficiency. That means the blood that is coming to the leg, it has to go up back towards the heart for oxygenation, and that the all blood that is supposed to go back to the heart, it's not reaching back to the heart. So there is an insufficiency in the venous flow, venous return to the heart. So that is what is called as varicose veins or venous insufficiency, commonly termed as varicose veins. This varicose veins is only a part of the spectrum of venous insufficiency. So other symptoms may be like the patient may have severe pain, especially while standing, pain on the calf, especially while standing, or the patient can have a edema, swelling at the ankle after standing for a long time, or the patient can have develop infections, or he can have bleeding from the leg, or the patient can have again ulcerations and all, which can further cause infections.
So how it is developed usually?
It is, as I told you, the blood that is coming to the leg, it needs to go back to the heart. The problem with the leg is the blood has to go against gravity. So for that, the mechanism in the leg, in the veins is actually there is a valve mechanism, that is a one-way valve mechanism. So when the valves are open, the blood will go up, and when it's closed, it will not go down. So in some people, these valve mechanisms get damaged for various reasons. It could be their genetic predisposition to the problem, or if the patient had an infection to the leg for any other reason, or the patient can have a trauma to the leg, or patient can have previously had a clot in the leg. So all these conditions will predispose to a damage to the valve. So if the valves are damaged, what happens is that the blood that is coming up, I told you earlier, when the valves are closed, the blood will stay up, but this closure will not be proper, adequate, it will not be efficient. So there is a leak in the valves. So what happens is the blood will flow down. So once the blood flows down, it gets collected at the ankle. So the pressure inside the leg increases. That's basically the cause for all these symptoms. Like it could be pain, it could be ulceration. You will have ulcers in the leg, especially at the ankle, or when the pressure increases, there can be a bleeding, or again it can manifest only with swollen veins.
Doctor, if we are having all these symptoms that you have already told to us, and if we are ignoring it, why we need to treat this? Is it will have any adverse effect to us if it is going for a long run?
Okay. See, varicose veins can be broadly classified into two types, symptomatic and asymptomatic cases. Asymptomatic cases needs treatment only if the patient is concerned about cosmesis. If the patient does not want those veins to be seen, then it can be treated. That is purely for cosmesis. But if the patient has symptoms, then one or other forms of treatment needs to be done. Why is that? Because one is to alleviate the symptoms. Otherwise, like you rightly asked, what if we ignore varicose veins? So what happens is there is a chance for the blood, the pooled blood to clot inside our legs. So if that clot goes into the deep veins, it can cause a condition called deep vein thrombosis, which is potentially limb threatening. You might lose your limb. And another important complication is this deep vein thrombosis. The thrombus can extend up to the heart, and then it can go to the lungs and block the blood vessels in the lungs, which is called a pulmonary embolism, which is a life threatening condition. So if you have varicose veins, you are predisposed to all these conditions, a deep vein thrombosis or a pulmonary embolism. And locally also you can have other issues, like the patient is predisposed to infection, and he can develop ulceration. All except for the pulmonary embolism and deep vein thrombosis, all these things are not life threatening, but it severely impacts the quality of life of the patient. Always the patient will have ulceration, that infection, pain, all those things. It will radically affect the quality of life of the patient. So if we usually do a Doppler to assess the condition of the limb, and in the Doppler and on clinical examination, if we see that this is something which needs to be treated, then definitely it has to be treated.
Doctor, can you please tell us what are the treatment options that we can give for varicose vein?
The treatment options, before that I need to, we will classify the patients into two. One is those who are symptomatic and those who are asymptomatic. All symptomatic patients will require some form of treatment, which I will elaborate later, and all asymptomatic patients again will require some form of treatment if we will do a Doppler, and if the main valves are involved, they will require treatment, some form of treatment. Again, if the asymptomatic patient falls into a high risk group for development of varicose veins, they also require stockings, compression stockings. Actually, compression stockings is the first line of treatment for varicose veins. It's not surgery or laser, anything like that. Pure stocking. Stocking means a special socks in which which needs to be worn during the daytime, and the blood, it will help to massaging the blood upwards, pump the blood upwards from our angle towards the heart. I mentioned earlier high risk groups. High risk group means patients whose jobs involve standing for a long time, which will include chefs, people in hospitality sector, surgeons, etc. So, if your job involves standing for a very long time, you will need stockings. Actually, even if you do not have varicose veins, then you will need a class 1 stockings at least to prevent the development of varicose vein. Once you have varicose veins, you either need a class 2 or class 3 stockings. And regarding the other treatment options. So, some patients, their disease condition suggests that their disease will not be cured or cannot be managed with the stockings alone. So, for those patients, what are the treatment options? The treatment options include normally classical treatment is a surgery, it is an open surgery, and now we have minimally invasive procedures which will help to ablate the diseased veins using either a thermal means either a laser or radiofrequency ablation, or non-thermal like sclerotherapy and all those modalities, or even we have now novel modalities like glue which will help to ablate the veins. So, either open surgery or a minimally invasive procedures like radiofrequency ablation or laser. Nowadays, these minimally invasive procedures are preferred than the open surgery because the results are better and the patient comfort and the pain, everything is much less, and the patient can go to work the next day itself. So, these are the treatment options.
So, doctor, I guess we have covered most of the queries related to this topic. Can you please give a takeaway message to our viewers?
Varicose veins are usually a benign disease. The problem is it can affect the quality of life. So, it is not something to be ignored. So, if you have varicose veins, it needs to be checked up, and if it is severe enough to be treated, you need to treat it according to your disease condition, and take care of your legs, keep the skin supple, keep yourself hydrated, and take care of your limbs. That's it.
Thank you, doctor. Thank you so much for joining with us and answering all our queries.
Thank you.
And I really hope that this episode will be an informative and useful one for our viewers.
Okay.
So, for any surgical need, you can contact Dr. Hafiz Ansari at KIMSHealth Hospital, Azam. Doctor, can you please tell us your timing and duty timing?
All days, I am available all days except for Fridays.
What about the timing, doctor?
Usually now because of Ramzan, there is timing difference. Otherwise, morning 9 to 1 and evening 4:30 to 8:30,
okay,
all
doctor,
days.
Thank you. So, next week I'll be coming with yet another doctor, same day, same time. Until it's Kripa Rajiv signing off from KIMSHealth Doctor Live. Take care and bye-bye.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
NEC Remit. Send money online to India. Credit in seconds with great rates. Download NEC Remit app now.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain, with over a decade of existence in Bahrain. Exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 3885 2397 or visit www.bahrainmediacity.com. Since 2006, Magnum Imprint have been offering high standards of quality with our professional team that delivers all your advertising and promotional requirements efficiently and promptly. For more details, please contact 39887088 or 33856330 or 33542530.